Good morning everyone, it's Amanda again with another in your series of health law lectures, NRS 123, and the topic this week is duty of care and professional negligence. I will begin by saying this is a very large reading in your set text, chapter 3, but if I can provide some advice, the areas that I'm highlighting today in the lecture are the areas that you should really focus on with your reading. So I suppose reading selectively is important, and I guess that the main areas that I think important to understand are the 4 elements that relate to professional negligence, and we'll go through those, understanding what is meant by the standard of care and understanding the doctrine of vicarious liability, because obviously if I'm raising them in the actual lecture, then they're important for a reason. So let's begin by just having a little bit more discussion on actually what constitutes professional negligence. It is an area of law that is probably most relevant to all healthcare workers because most commonly it's the area of legal action which they're likely to face. Perhaps, obviously, nurses, we certainly come before the courts in relation to falling below the standard of care, and in cases of professional misconduct and unsatisfactory professional conduct, but actually going through the courts for being civilly negligent is actually fairly rare for a nurse, but it certainly can happen. It's much more common for medical practitioners to go through a civil case. When you realise that I think this is important, what you've learnt in your earlier readings, the difference between criminal and civil law. It's really important to distinguish between the two. By and large, the area of professional negligence is an area of the civil law. It's looked as a tort or a civil wrong where a patient or a plaintiff who believes they've suffered damages can seek a civil action through the courts, the civil courts, to receive monetary compensation, which is very, very different from being criminally negligent. Criminally negligent is a very, very rare thing in healthcare, and usually the ones that are criminally negligent will hit the news, and the ones that probably are most recent in Australian history are the case of Jayant Patel, and there was also a very famous case in Britain of the case of the doctor who was killing patients as well. So it's all to do with intent, remembering if you're understanding the difference between the criminal system and the civil system. The criminal system, it's about when a crime's committed, actus reus, there must have a guilty mind and there must be an area of intent. Whereas, again, civil, it's just about someone's actions through the course of their professional conduct. They owe their patient a duty of care. Their standard of care falls below that expected. Patient is harmed. Therefore, the patient can then seek civil compensation. So it's important to know that most areas of professional negligence are in the civil court or under that banner of the torts, civil wrong. All right, there's some other civil wrongs, nuisance being one. So you've got negligence, professional negligence is a tort, public nuisance is a tort, and also defamation is a civil wrong or a tort. And we look at that a little later when we look at healthcare records and so on. So when you're professionally negligent, a health professional fails to provide a reasonable standard of care, and it's very, very relevant to nurses in particular. Different ways that nurses can be professionally negligent are in the following areas. For example, and all the cases that we look at, the ones that we've looked at, the Nurses and Midwives Council, the actual cases we pull up for you, they'll usually constitute something in the area of, for example, failure to follow a standard or failure to use equipment safely, failure to communicate adequately, or failure to assess and monitor adequately. That's a big one. Failure to detect the deteriorating patient. So many of the cases that we look at throughout the session will have either one or a combination of a lot of those things, all right? Certainly, very, very relevant to health professionals. Now, if a nurse were to become subject to a civil action of negligence, which would be quite awful, remembering that, many nurses do something wrong and they might face a professional standards committee or the tribunal for something more serious. But this is where I want to stress, it is reasonable to expect that if a patient is actually harmed as a result of the nurse's action, in addition to the professional sort of hearing, you will also or could also face the court as well, the civil court, and be a witness or the defendant in a case where the patient's seeking monetary compensation. Now, proof of negligence is very specific, and I think it's important to highlight the fact that the term negligence is used very, very widely and broadly in some cases, but I want to stress here that in law, being professionally negligent is very, very specific. A nurse can breach their duty of care, but not necessarily be professionally negligent. To be professionally negligent, all 4 elements must be established, and the 4 elements are that that the defendant owed the plaintiff a duty of care. The defendant in this case is the nurse, the plaintiff is the patient. The nurse's conduct fell below the standard expected. As a result of the breach, damage must be done to the patient and must be proven, and that the damage the patient is complaining about is reasonably foreseeable and a consequence of the nurse's or doctor's negligent act. So it's quite specific, and it is the burden on the plaintiff or the patient's defense legal counsel that they must prove all 4 elements. And the burden of proof is unlike in a criminal case where the evidence must be beyond reasonable doubt, when you realise that in a criminal case, obviously it's backed up with a sanction of punishment, usually, obviously a jail term or something like that. So it must be very, very high standard of proof. But in a civil case, the standard of evidence is a little lower. It's on the balance of probability, and that simply means that it is the legal counsel or the patient's counsel or lawyers just need to prove that it is highly likely or more than likely that the negligent act on behalf of the nurse caused the damage. So that's important to consider. So we're going to go through each of those in turn now. Now, duty of care refers to the legal obligation on a professional basis to exercise reasonable care and skill in the provision of professional treatment. So you can clearly see that any nurse or doctor, through the scope of their employment when they're on shift, there is a relationship between their patients, and it's a legal relation, it's a contract that exists between them and their patients. So there's clearly a duty of care if you're at work. For example, say you were at work, and say you were working in a mental health facility and one of your patients was outside and you were running after them, something like that. Now, there was a member of the public watching, and they watching you chase this patient. And they fell over, hurt their head, and then they decide to lodge an action against you, the nurse, because they say you caused my bashed head. Well, it's clear there that the nurse doesn't owe that person who's the random person walking along a duty of care, but they clearly have a duty of care to their patient. So make sure you read that in your chapter 3. Duty of care is the legal obligation to exercise due reasonable skill and care over your patients. Now, this bit of being reasonable in terms of the care and the skill that you provide is important. It can vary. Now, how it's measured, they have to measure the reasonableness of the care that you're given. So in the event that you are actioned or cited in a civil case, and say you provide the wrong medication and it kills a patient or harms a patient in some way, the standard of your care will be looked at by others. And the way that one of the main ways they measure that or observe it is by asking peers. So the ordinary reasonable nurse, for example, if it's administering medication, every registered nurse who's even a first year new grad should be able to administer medication appropriately, S4 drugs, because they've got the skill and the training to do so. So that's a fairly broad opinion that any nurse would be able to do that, provided they've completed 3 years of training, they've registered, and they should have the necessary skills and experience and training to do that role. All right, but that's a normal standard of care. All right, so but sometimes there's specialized standards of care. For example, say there was a critical care nurse who's got 10 years experience. Well, they would be expected to operate at a much higher level than someone who's a new grad. So a new grad, for example, working in a coronary care unit, a patient complains of chest pain. A new grad might be able to respond, or what would be expected of someone of that level, of that scope of practice, would be to perhaps do an ECG and then inform the doctor. Or it might simply be enough to, depending on the ward protocol, just for that new grad to immediately call someone senior, someone doctor. But say it's someone with 10 years experience. The patient complains of chest pain. Well, an experienced coronary care nurse would be expected to respond by giving the ECG, interpret it, and then follow maybe a cardiac care protocol. So the standards of care, which are totally tied up with your duty of care and what, how reasonable you're expected to be, can vary from unit to unit and depending on your level of experience, which is why it is so important that all nurses are aware of their scope of practice wherever you work. All right, so it's very important. Scope of practice, your standard of care. Where do you get that information? Well, that's your standards for practice that we've spoke about earlier that are highlighted in the Nurses and Midwives Board of Australia. The second element or principle that must be established is that the nurse's conduct fell below the standard expected. In other words, there is a breach in that duty of care that we've just discussed earlier. Now, there is a breach of duty of care when a nurse fails to deliver care of a standard that can reasonably be expected. For example, if a nurse in an ICU didn't take at least hourly neurological obs on a patient who'd presented with headache and nausea, this would constitute an inadequate standard of care. A nurse in a palliative care unit would not be expected to take neurological observations of the patients. If a nurse in a palliative care unit did not check a patient's skin for pressure ulcers when bathing her or him, this would constitute an inadequate standard of care. So it is based on the role that the context that you're working on, just as I explained earlier. And it can vary, but there's no doubt that nurses breach their duty of care in lots of ways, whether it's failure to communicate, failure to detect a deteriorating patient, failure to use equipment correctly. There's lots and lots of ways, so be aware of those. But there's a breach in the standard expected, and we look at lots of those as we go throughout this. The third condition that must be met is the damage. Damage must be done, and this is really important. It's not, a patient sometimes might complain that they were placed at risk, and that is a breach in a duty of care. But is it going to go to a full-blown civil case? No, because this is important. Damage must be done. There's different types of damage. Obviously, the most typical in healthcare particularly would be personal injury, or the worst case scenario is death. There's also psychological pain and suffering. It could be damage to property, which is other types of negligence, obviously, and economic loss. So obviously when there's a civil action, depending on the circumstances, the context and the damage done, they'll go for lots and lots of different things. But damage must be done. And to give you an example, the biggest one I use, for example, say you are showering an elderly patient that you know is a substantial fall risk. You take the patient to the shower in a commode. You get called away and you leave that person unattended for half an hour. Now you come back and happily your patient is still sitting in the chair, freezing and cold, but they haven't fallen off. But have you breached your duty of care? Yes. Is a duty of care owed? Absolutely. But is damage done? No. But still, your conduct is well below. But it sort of illustrates that if, the patient had fallen off and cracked their hip and then obviously subsequently pursued a complaint that way, you may very well face further actions against you. But I think the whole process here, and this happens every day of the week, where conduct is well below but no damage is done. Remember, it's only when something happens that patients will complain. But this is again reiterating the importance of adhering to standards of practice, your protocols, and not cutting corners, because it'll be that one time, even in documentation, that failure to document properly can result in, negligence and so on, or sort of prove the case against you. So as we look at many cases, particularly the case of Mark McCabe, because it was the failure of documentation there that resulted in poor communication and ultimately poor Mark's death, which is a very interesting one. Rogers v. Whitaker, that's the case. I think I've mentioned it before. Mrs. Whitaker with the eye. Again, there must be a causal link, which we'll talk about in a minute. So you can look at that case as well. But damage must be done. And that's sometimes the most difficult one for the plaintiff's team to prove. The fourth principle or element that must be established is that the damage is reasonably foreseeable. So the nurse or the hospital, who will be vicariously liable, should not have to pay for damage that is too remote a consequence of the nurse's act. It was not reasonably foreseeable. So there must be a link between the damage done and the nurse's action, is I suppose the best way to see that. And I suppose there's lots of examples in your text there, but the one that I always sticks in my mind, and it's again concerning an ophthalmologist. They seem to be very, very dangerous crowd, with the Rogers v. Whitaker and the other case where it was quite a number of years ago, but it was established in common law, which meant it was a test case, and it was to do with the degree of being foreseeable and the link between damage done and the defendant's act. And what it was, the ophthalmologist, and these were the days where you had your test for glaucoma. Now it's simply the tonometer's a puff of air. It's very high tech. But in those days it was like an old brass contraption that had to be heated up by a Bunsen burner and then applied to the, when it had cooled down sufficiently, was applied to the eye so that the clinician could measure the intraocular eye pressure. Now, in this particular case where the patient sued, the doctor in question, he heated up the tonometer, the brass mechanical thing, and then he didn't allow enough time to let it cool before he applied it to the eye of the poor patient, who then had a burnt eye and was blinded as a result. So it was reasonably foreseeable that any normal ophthalmologist should have known that. And that's that degree of being, reasonably foreseeable. So the harm must be foreseeable. Another example, I suppose, just to finish in terms of from a nursing perspective. Say you're looking after a diabetic patient who's having regular home visits by a community nurse, and she's having an isotonic saline solution dressing to a leg ulcer. So one day a new nurse visits to do the dressing and finds that Olga has run out of this saline solution. Now, the nurse finds some methylated spirits and decides to use this to clean the ulcer. Is this a reasonable standard of care? Absolutely not, because the reasonable nurse, anyone of that level of training, should know that applying methylated spirits will cause pain and ultimately destroy the cells of the skin. So it could be, if Olga, poor old Olga, was to go ahead and pursue a civil action, that this nurse had a duty of care. They breached that duty of care by not acting with a reasonable standard of care. They should know that applying methylated spirits is dangerous. Harm has resulted and the harm was foreseeable. The nurse should have known that methylated spirits would cause damage to the wound. All right, so hopefully that explains that principle there. I guess many of you might be worried about, if it ever were the case where I was cited in a civil action, would I have to pay the damages myself? Well, this is where the doctrine of vicarious liability comes into play. Now, this is vicarious liability is a common law principle. That is, it's not a rule, it's not statute law or parliamentary law, but rather it's a legal principle embodied in legal judgments over time. It's common law. Remember the two distinctions there. So when a tort of negligence is proven, the negligent party is liable to pay compensation for damages done to the plaintiff or the patient. Now, the amount of money is decided by the court. Most, but not all, nurses are protected from paying damages by the principle of vicarious liability. Again, sometimes it depends if you are, a midwife who's practicing on your own. So that's when you'll have professional indemnity insurance. But by and large, for those nurses working in a public hospital, the employer or the hospital bears the financial burden or responsibility for compensation of harms if employees are negligent in the course of carrying out your duty. In other words, so vicarious liability is a transfer of financial liability from the nurse to your employer. All right, so that is good to know. In the case of the dreadful case that you were cited, would you be having to pay yourself? But I think it's important to realise is that the negligence that your employer will play, firstly, you've got to be established to be an employee, which as a nurse, if you're working for Bankstown Hospital, would be established quite clearly. And say your breach was in relation to you're working in a surgical ward and you failed to check a prescribed intravenous medication properly and you administered the wrong drug, causing the patient to suffer damage to the kidneys, you would be negligent and the hospital would be vicariously liable. Now, and that's through the scope of your employment. So I think, though, just bear in mind that if you were so outside the scope of your employment and were reckless to the degree that your scope of employment could be argued. So I just think it's a cautionary note that 99% of cases, and it's rare that nurses are ever cited where it goes to full monetary compensation. It's relatively rare. However, in the case that you were cited, the hospital's vicariously liable. They'll pay the damages, provided that the job you were doing, even though your standard fell below and you hurt someone, it was still through your scope of your employment. All right, so just remember that. Okay, so that might wind it up for this lecture. I've tried to keep it very focused. Read the relevant chapter in your text, and it's chapter 3. It's very lengthy, I do understand that. So read selectively, but it is important that you understand the notion of professional negligence, and we'll follow that up in the tutes. Okay, thank you.